This is the Get Global Young Professionals Talk Global Health podcast, envisioned and created by the Irish Global Health Network and their student outreach team. I am your host, Megan Davis, Communications and Events Intern at the Irish Global Health Network and second-year medical student at the Royal College of Surgeons in Ireland. In this series, join me and my student outreach team co-host Aidan Desjardins, a microbiology student at Trinity College, as we talk to inspiring young professionals leading the charge in their respective fields, often operating in sidelines to their career, following their passions above all. Today we are excited to speak with Viveka Guzmán. Viveka is a medical doctor from Mexico with a master's in global health from the University of Gothenburg in Sweden. She is currently pursuing a PhD in population health and health services research at RCSI. Here is a segment from our conversation.
Global health is a super open and warm world to work into. I think absolutely everyone is welcome in global health. It doesn't matter what background you have, what kind of upbringing you had, like every perspective is needed for global health.
Viveka is passionate about planetary health and is also very interested in science communication and co-participatory approaches. Welcome to the podcast.
Thank you so much for having me. Great delight to be here today.
We usually start by asking guests how they got into the field of global health. So how do you find yourself involved in global health?
Yeah, I think that's a great question. I mean, in hindsight, I think I got involved with global health before getting to know what global health was actually about. But for me, I think the first encounter I had with global health, like that slapped me in the face, was when I was doing my medical training. And I think it was just seeing that patients could have very different outcomes depending of their kind of determinants beyond what was happening in their physiology. So if I had a patient maybe with the same disease, it could look very different if they had support from the family networks, or if they had kind of financial means to treat their disease or to take care of it after. So I think that was the first kind of slap in the face of saying, okay, there's something happening here and I want to know more. And then I got two chances that I think for me were kind of crossroads into making me decide to go into global health. So I had the opportunity to work as a clinical doctor in two remote settings in Mexico. So the first one was kind of a tropical inferno, where I was kind of the head of a small clinical setting. And there it was really trying to make the patients receive the care that they needed in very limited kind of environment. So you had to be very creative and kind of very lucky, in a way to have a good outcome. And the other opportunity that I had was in kind of an ethnic minority group that is in the north of Mexico. So there, it was also clinical work, but there was a lot of advocacy ongoing with the community trying to train their own members of the community as community healthcare workers, and kind of to have like ambulance access to receive the transportation to the bigger community centers when they needed it, and that kind of thing. So that really got me into thinking, okay, I want to do more of this, but I think I need more training in research, more training in policy and advocacy. So that's where kind of the formal training in global health started for me.
So you mentioned the social determinants of health. So can you describe how doctors can be more aware of this in practice?
I think ideally it would be fantastic if we received formal training in our curriculums. I think at least at the time when I pursued my training, that was lacking a lot. There was very limited discussions from public health and from epidemiology, not even to go into full discussions of social determinants. So I think something that is needed is to include those discussions in the curriculum. And I think then for kind of having these diverse opportunities of engagement, not just in the hospital, but also working in the rural communities or in disadvantaged communities, it really opens your eyes to being like, okay, this is social determinants in action. It's not just in the book, but I'm able to see it in day-to-day life and the effects that can have. So I think that's what would be very beneficial for medical people to learn.
You also mentioned there tying in both advocacy work and clinical work. How do you think we as young professionals can kind of tie that into our efforts in our work?
I think it can be a hard thing to do depending on the setting and the environment that you're working. Sometimes it's hard to wear two hats at the same time. I know that sometimes, for example, as a researcher now, they're saying like, okay, you can't do too much advocacy because your actual voice shouldn't be in your research. And I think that can happen sometimes as a clinician. But then on the flip side, we have to recognize that that position as a clinician or as a researcher is really a position of great power, and you can use your words really to advocate for the things you believe in. So I think, okay, maybe you have to be a little bit careful in the way you approach it when you're at work, but there's definitely venues where you can manage it, and you can get just talking with other people who are around you, and then maybe trying to organize some types of events and find people who are like-minded, and then maybe chip in the ones that are not like-minded, but push some buttons in there. It can be helpful.
Thank you for sharing your experience there. We understand that you're currently pursuing a PhD in population health and health services research. Can you tell us a bit about what areas of research you're focusing on?
Of course, yeah. I think I very much welcome any chance to talk about my PhD because my partner can't take it anymore. But yeah, so I'm focusing on mental health and well-being of older populations during public health crises. And under the kind of public health crisis umbrella, I'm focusing particularly in infectious disease outbreaks. And because of the current situation, of course, COVID is like the proxy of many of my PhD components. Also on the side, I'm collaborating in another couple of projects that are related to global health. So they're both with health geographers. So one of them is with Dr. Bruno Foley, who is also my supervisor. And the other one is with Dr. Jessica Finley. And I mean, there's discussions of kind of environmental space from a geography perspective, for me, was just mind-blowing because it does take a very deep understanding of how place and contact with nature can shape our health and well-being. And for me, that kind of touches a little bit in my interest in planetary health. So kind of this really understanding how our health is so deeply interconnected with the health of the environment. And I think there's a few other projects that are maybe not research output related, but that go hand in hand with my planetary health interests. So, for example, I'm working with a group of student ambassadors, and we're working in creating a children's book that is called the ABC's Book of Planetary Health. So that's one of the things that I have been very proud to be working during the last year is an international group that is being led by two fantastic students from the University of Toronto. So that has been a great experience that is not research per se, but that's good for the soul and good for kind of the advocacy and bringing things together.
Awesome. Thank you so much for that. As you mentioned, much of your work and your researches focuses not only on the impact of epidemics on older adults' health and well-being, but also on the accessibility issues and inequalities they experience across multiple social, economic, and health dimensions, which are not always spoken about as much as they probably should be. In your opinion, what should we take away from this pandemic to build a better, more equitable and inclusive future for all ages?
I think I definitely agree with you there that kind of COVID has highlighted vulnerabilities that we're aware they existed before, but they become kind of blatant with COVID. And I think that's something that we should carry on from here on is the opportunity for collaboration and also kind of this system approach that came with COVID. So we realized that it's really not that hard to create international collaborations where there is will. And I think that's something that we should carry on. And maybe I'm biased here, of course, because of my interest in global health, but I do think if we put health at the core of the initiatives, then it's kind of easier to bring everything together. Like I see the relationship in health, anything is related to health. So we can make others maybe see it that way. We can create those collaborations. And in terms of kind of this life course approach or accessibility for everyone, I think is really about environmental conditions. So we create these environments that enable health for people who have different characteristics, not only about age, but also people maybe who have different mobilities of different genders. And we create this space that are good for all of them and that are kind of responsive to all of their different needs. I think that would be a fantastic takeaway from the bad things that we faced during COVID.
So You mentioned fostering further collaborations. So how do you think we as young professionals and others in similar position can foster collaboration and work across different disciplines?
I think a great place to get started maybe is to look at the different student organizations that are out there. So I believe that most campuses in Ireland would have an organization that is working with Go Health. For example, you are a fantastic example for that. And I think there are a few others as well. For example, the one I mentioned there with the kind of Planetary Health Alliance, and they're actually now looking for student ambassadors for the next year. So something, maybe if you're interested about that, maybe you could take a look at what they're doing. There's the Global Health Next Generation Network. And so I would say kind of maybe start by looking what student organizations are already doing out there. And if there's something that you're really feeling very passionate about and there is no organization that is working into that, maybe you can organize yourself with some other people that are around you. So I'd say like, maybe so you don't have to start from scratch. That is very helpful, but also don't be scared of starting from scratch, because there are fantastic examples of things that start from scratch and they just grow massive from there.
So you had previously mentioned planetary health. So COVID-19 has exposed both the fragility and interconnection between individuals, communities, and the environment. What type of planetary health reform should policymakers implement in our cities that are not just temporary solutions?
I think that's a tough question, but a very, very good question. And I think the role of politicians and policymakers here for planetary health should be to make it easier for all the individuals to make the right decisions. So by make the right decisions, I mean kind of, okay, we know for planetary health and for our own health is better kind of to move into active modes of transport. We know that air pollution is bad for our general health. We know that the models that we have for food consumption are not sustainable. So as a politician and policymaker, I would expect like proper legislation that can support that, because without the proper legislation, these things will just flounder around. We have great examples from COVID, for example, with the cycle lanes that have been put around the world and here in Ireland. But unless there's legislation to protect them, they will go away. So I think that's what I would expect for the policymakers. And that being said, I think there's a role there for students and for global health professionals as well to provide the evidence that supports those kind of policies.
I would wonder if public outreach also plays a role. Like you mentioned that a children's book on planetary health, which sounds absolutely amazing. How do you think we should reach out to the public more and, communicate these issues that are going on?
I think there's a whole realm there of opportunities. I think we have so many ways now to communicate our findings. And I really think that we have to tap into more creative methods. So I think storytelling, is something very, very powerful that we can tap into the way like podcasts, I think infographics, I think just letting people who are being affected by these issues kind of carry the voice and tell in their own words what is happening is a very, very powerful tool for advocacy that we're not maybe using as much as we could. So I think that would kind of make the message a lot stronger and carry it a lot farther than we can do just with journal articles or something like that.
Would you mind sharing a little bit more about the ABCs and Planetary Health book? I think it just sounds like an amazing project.
Yeah, of course. So it started kind of when we all got elected as student campus ambassadors for 2020. So we were just getting started, I guess, with our great plans for bringing planetary health into our campuses when COVID hit. And then kind of we met online because we're all based internationally. I think we're around 40, but around 20 of us came together in an online meeting. And we said, you know what, I have so much frustration. I had all these plans about things that were going to happen in my campus and what am I going to do now? It's like, okay, let's start brainstorming about what we want to do. And there was then this group of 18 people who said, okay, let's do a book for children. There was a grant going for projects related to COVID. So we said, okay, let's try to get that money so we can actually then get some help for the final steps of kind of getting some designer to do nice drawings and stuff. And so it was a long process. We got together a few times kind of to discuss what kind of book we wanted to create. And at the beginning, so none of us is kind of very advance into creative writing or anything like that, but we all felt passionate about kind of this storytelling. So at the beginning, we tried to, each one of us, kind of create a different story about a kid who was in a planetary health challenge, and he was like a hero. But then we had so many issues into making this culturally sensitive, because we were like, okay, but where are this kid's face and what are the backgrounds and kind of that stuff. So then someone said, I spoke to my kind of the sons of one of her siblings. And I said, like, why don't we do this ABCs of planetary health? So I don't know if you have ever seen these books, but you have like a word for each one of the letters in the vocabulary, and then you create kind of an image that goes with that. And that was a lot more efficient way to work. So yeah, I'm very, very excited. And then we had a team as well of the people doing some illustrations. And then we brought it together with the designer who kind of, made them look kind of similar and brought like a nice palette to put into all of them and that kind of stuff. So it's hopefully now kind of in the final stages, and people are working now in transcribing it into different languages, and hopefully we'll have as well some prints for the communities who are not reachable without internet and that kind of thing. So I'm very, very excited about this, and hopefully we can share it early next year.
Well, we can't wait to see it in the bookshop over here.
You can get a free copy, yeah.
I mean, sounds good to me. But before we wrap up, what is one piece of advice you would give to someone looking to work in the field of global health?
I would say go for it. I think global health is a super open and warm world to work into. I think absolutely everyone is welcome in global health. It doesn't matter what background you have, what kind of upbringing you had, like every perspective is needed for global health. So if you have even a little inch of interest in global health, just start your journey and don't be afraid of getting lost in global health. I think it's a little bit easy to get overwhelmed by what specifically you want to do in global health. I think it's okay to navigate into different topics, into different methodologies, and you can transfer all of that. And once you find your niche and the thing that you are very, very passionate about. So just go for it, I would say.
Thank you so much for coming on the podcast, Viveka. This was super inspiring. Love everything you had to say about global health. And if you would like to learn more about the Irish Global Health Network or the Student Outreach Team, please visit www.globalhealth.ie, where you can sign up for our newsletters. Thanks again for tuning in.